A Kenya Medical Supplies Agency, Kemsa, will lose 2.3 billion shillings by selling dead stock bought at 7.1 billion shillings that has been lying at their warehouse. A directive to sell to counties has come from the Health Cabinet Secretary Mutahi Kagwe at a time when parastatals are cautious while engaging with Kemsa. Kagwe has also expressed a different view regarding the COVID-19 vaccine by Pfizer. KTN News Health and Science reporter Saada Hassan has more for us.
Days after news of the 90% efficacy of Pfizer and BioNTech vaccine for COVID-19, the Cabinet Secretary for Health, Mutahi Kagwe, seems to be riding on a different wave.
Yes, we are hearing there's a vaccine. Yeah, as you know, yesterday Pfizer said there's a vaccine, but I really personally, to tell you the truth, I've got my many doubts about it because we're talking about a disease that stops people from getting the virus. Now, I would like to know how they knew in the first place that I was going to get the virus so that the vaccine, you know, you're talking about a treatment. When I have a virus and it goes down, I can understand the measure. But when you tell me that I stopped you from getting the virus, how do you know I was going to get the virus in the first place? So for me, I have reservations. I have my reservations.
He was speaking during a meeting with some senators to highlight issues facing NHIF and the progress of the country in managing the virus. Kagwe now wants county governments to directly purchase personal protective equipment from the authority. As a result, Kemsa will face 2.3 billion loss that will also be reflected on those who got the tenders.
There is nothing to say that they should not sell now and take a hit of 40% or 50%, rather than wait for next year and take a hit of 90%. We have no idea what is going to be happening next year in terms of those prices.
Appearing before the Public Investments Committee, Kemsa was unable to defend their tendering process, admitting to the committee that they never got approvals from the Ministry of Health.
That amount of money was the normal budget that you've been given for the financial year 2019-2020. We are talking about the billions that you put Kemsa into a liability at. Were you given approval to spend that money? Yes or no?
Mr. Chairman, the answer is no.
Then why did you have to start by telling us that you were given those approvals?
Meanwhile, the country has recorded the highest number of deaths at 26 in the last 24 hours, raising the number of fatalities to 1,180. The number of new infections has risen to 1,216 out of a sample size of 6,816. This brings to a total of 65,804 COVID-19 infections. 531 patients have recovered, with 382 from home-based care program and 149 from various hospitals. The number of recoveries now stands at 43,626. Patients admitted in hospitals are 1,289, while 5,960 are on home-based care. Saada Hassan, KTN News, Nairobi.
Nairobi Metropolitan Services is out to save one tree in the city. And what is so unique about this tree, you may ask? Well,